It is no longer a death sentence. That's exactly what a diagnosis of HIV once was, but awareness around the disease and new treatments has reversed that trend. With World AIDS Day upon us once again, the hurdle is to overcome the persistent stigma that swirls around HIV and improve testing results.
Meet 3 young people that are all impacted by HIV.
It's a new video telling the story of 3 teens and their bid to raise awareness about HIV/AIDS. BC is leading the way with programs such as Seek and Treat for Optimal Prevention or Stop HIV/AIDS.
We're still working hard to raise awareness about HIV, to engage people in prevention, primary prevention, to promote knowledge about HIV and getting people to be tested early.
In 2012, a new educational campaign around HIV and the importance of being tested was launched. That's because in BC, it's estimated 25% of people living with HIV are unaware they have it, and those who are undiagnosed contribute up to 75% of new HIV infections. The challenge in northern BC is geography.
We're so spread out. We are actually in the midst of trying to create that a pathway for people who will be diagnosed in the more remote regions so that they can have access to services is equal to those in the larger urban centres such as in Prince George.
Northern Health recognizes the efforts to reach out and raise awareness for those who may be living with the disease, but there's also the need to reach out to the caregivers.
I think that's one thing that we're really working on, is having the standardized forms and the consistent messaging and raising that level of education so that they could have their provider competency increased as well, because for a lot of people, HIV is a specialized field.
But the picture is not entirely grim. Nationally, since 1996, newly diagnosed infections have increased by 66%. Early diagnosis and modern science mean people can live healthy lives, but testing is the key, and the BC government released new testing guidelines this past May.
The guidelines for testing now advocate that anybody who's between the age of 18 and 70 should have a test at least every 5 years. So that they can be diagnosed if they happen to be infected, and they can be diagnosed early.
Those at a higher risk should be tested more frequently, like annually. Cheryl Jan, CKPG News.